Good morning, everyone. Thank you for that, Professor Vayena. So my name is Nezerith Cengiz, and today I'm here to present on the governance of cross-border transfer of data in sub-Saharan Africa. So I am presenting on behalf of my team on a recent publication where we explored governance considerations that ought to apply to the collection, transfer, and use of data in public health emergencies. We provided an overview of data sharing governance landscape in South Africa, Nigeria, Kenya, Ethiopia, and Uganda. So these 5 countries are sub-Saharan Africa's most research-intensive countries that are characterized by diverse data management and privacy governance frameworks. So we also identified limitations and gaps that hinder effective data collection, sharing, and analysis. So this work is descriptive and forms part of the early or initial stages or phase of our research. So the COVID-19 pandemic has highlighted the importance of data sharing in the public interest, but data protection and privacy concerns with data sharing in open science remain a challenge. In order to inform clinical decision-making, scientific endeavors, and also policy-making, the collation, storage, and use of personal and aggregated health data are required, especially in the clinical and public health management of pandemics. So when thinking about the COVID-19 pandemic, it required greater international and regional cooperation, especially in accessing and using data collected to inform policy making beyond the data source given the global impact of the disease. So firstly, appropriate infrastructure in a country is essential for effective collection and storage of data, as well as appropriate analytical capacity to understand the implications of the data. However, this is not the case for many African settings with limited internet access, poor quality data sources, and inadequate analytical capacity. So appropriate data collection, storage, and analysis is needed to strengthen evidence-based approaches to in managing pandemics. And although many African countries have data protection legislation, a gap still exists in the availability of data sources and the analytical capacity. So there are some barriers to the effective management of pandemics, including the lack of harmonized data sets and information systems, and also that time-sensitive data access is not always possible. So access to large, high-quality data sets is important in the development of AI models, which can help optimize predictive decision-making in health pandemics. The development of national health information systems that include both public and private sources of health data is another essential element in managing health pandemics at a country level. So some data sources are required to effectively respond to pandemics in terms of supporting evidence-based approaches to managing a pandemic. And these sources include primary data sources, epidemiological data, and omics research data. So there are also key limitations in data sharing that can hinder effective pandemic response. And some of these include an inability to gain timely access, as mentioned earlier, to data during a pandemic or public health emergency, a lack of trust about the future use of the data, or academic competition relating to who publishes first, also insufficient data transfer regimes, which all contribute to the potential unwillingness to share research data. The different data needs of various stakeholders, which in turn also makes it challenging to have some sort of a common approach to data sharing. It's also important to take note of how the scope of using data in the management of a health pandemic is limited by incomplete and also data of poor quality. So there are some key initiatives aimed at facilitating cross-border data sharing in Africa. I won't go through all the examples, but some examples include the African CDC, which that is supporting African member states develop and establish high-quality public health information and technology systems. So another initiative by the African CDC involves enhancing secure electronic transmission of data and reports, facilitating the development and promotion of network domains, and adopting informatics guidelines and standards to enable interconnectivity and electronic transmissions of data and information among other CDC institutes. So we do have more information on this in our paper itself, if you'd like to go and read. According to the Open Data Institute, data sharing is characterized by stewardship of data, which entails collection, maintenance, and sharing, and then creation or creating information from the data, which entails analysis and insights, and also making informed decisions utilizing the data from various sources. But various barriers can negatively impact on public health data sharing initiatives, such as economic barriers, like the lack of resources in a public sector, legal barriers like ownership and copyright issues, and ethical barriers like the lack of reciprocity in data sharing practices. So, equitable, ethical, and efficient data sharing constitute key principles to enhance public health data sharing in Africa. The principles of transparency, accountability, and fairness are also important in the context of responsible data use and should also guide the drafting of data transfer agreements. So the OECD, which is the Organization for Economic Cooperation and Development, published recommendations on enhancing access to and sharing of data, which include promoting trustworthiness of the data ecosystem, enhancing transparency of data access and sharing arrangements, incentivizing data access and sharing, and fostering effective and responsible data access, sharing, and also use across society. So in our paper, we also highlighted the minimum requirements for data transfer agreements in a research context. So some of these include responsibilities of the provider and the recipient of the data, the purpose of the use of the data, description of the data, time period of the agreement, access to the data, confirmation of adherence to all the legal requirements for lawful processing and publication of the research results based on the transferred data, ethical clearance, and so on. We have got more details in our paper. So when thinking about Africa's data sharing regulatory landscape, many countries have started initiatives to regulate data protection. So we looked at the 5 most research intense countries in sub-Saharan Africa. So those were the 5 countries I mentioned initially: South Africa, Nigeria, Kenya, Ethiopia, and Uganda. We considered this based on research output, and we also wanted to briefly consider how these settings manage cross-border transfer of cross-border data transfers. So I'll quickly go to the next slide, and then I'll get back to this one. So our legal experts looked at this and tabulated this for us. So this table merely categorizes the rigor of national data protection laws regarding cross-border transfer of personal data, and is not aimed at providing a strict overall categorization of the various data protection laws. So it is focused on the scope of legal protection afforded to data subjects in relation to cross-border transfer of their personal data. So just to briefly go over the categories, we've got stringent, moderate, and inadequate, and taking into consideration those 5 countries that I mentioned. So countries with stringent rules require notification of or approval by a relevant data protection authority and or special conditions such as proof of appropriate safeguards, as well as consent from the data subject. Then the next category, countries that fall under the moderate category, would allow for more than one possible legal ground to permit data export, such as consent of the data subject, but does not require notification or approval by the Data Protection Authority. Then we also have the final category, but none of those 5 countries fall into the last category, which is inadequate. So data protection legislation that does not contain any provisions pertaining to cross-border transfer of personal information could be described as providing inadequate protection to data subject in relation to the export of their personal data. So you can, we again do have more details in our paper regarding this. So back to the previous slide to continue. So the diverse legal landscape governing data sharing in sub-Saharan Africa highlights that cross-border data transfers will have to be evaluated on a case-by-case basis, as there is no uniform law across the African continent. So it is important to note that for research ethics guidance, we do have 29 sub-Saharan countries that have published some sort of guidance regarding the collection and use of human biological specimens, which are essential in national health systems and important to consider in national research cooperations. So cross-border data transfer of personal information may only take place if certain requirements are met in accordance with applicable local legislation. So some of the common conditions enforced in various data protection laws include, so I'll just go over about 2 or 3 of them. We do have more details in our paper because of time. So one would be the third-party recipient of the data is subject to law or binding agreement, which provides adequate protection. The data subject gives consent to the cross-border transfer. The transfer is for the benefit of the data subject, and so on. There are a few more. So there are also factors to consider in the processing of personal information, including the need for a time limit for the retention of the data, clarity and a sound basis for the purpose of the data processing, proportionality of the measures taken in processing the personal data, transparency and explainability, accountability, and among others. So finally, I'm going back, sorry. Okay. Finally, the COVID-19 pandemic has highlighted the need for a reliable and accessible data ecosystem that could inform the management of public health threats. Harmonized data sources and their integration into the national information systems will create a comprehensive data set. So such a holistic approach to data management should underpin evidence-based decision-making. Transparency, fairness, and accountability should underpin the development of a reliable and accessible data ecosystem. And to facilitate cross-border data transfers involving personal data, standard contractual provisions and templates for cross-border data transfers should be developed by data protection authorities in Africa. So also acknowledgements, first and foremost, the NIH, of course, and then as I mentioned in the beginning, this was a collaborative effort, and here are the names of my co-authors, Dr. Dirk Brand, Prof. Jerome Singh, Prof. Annalise McKay, and Prof. Kimantri Moodley, who is also the senior author of the paper and also the PI of the REDSA project. So unfortunately, the rest of my team couldn't make it, but we do have Prof. Kimantri Moodley in the audience here. I have brought some copies, actually quite a few copies of the paper in case anybody would like to read it or would like some further information. This is the paper that I was referring to in the presentation. Thank you so much for your time.
so much, Nezerith. You can come over here. And we can take some questions now before we move on to our next presentation. If there are questions of clarification, we also have allocated time for discussion. There. Okay. Catherine, are you having a mic down? Yeah, perfect. Okay.
Hi. Good morning. Thank you for the nice presentation. So in all the regulations, in the guidance in the 5 countries, did they make a difference between data shared for AI users versus secondary data use for other users? They say that, okay, if it's AI, then here are the additional requirements, or no distinctions have been made. Thank you.
So our legal team, our legal experts, basically compiled. They were the ones, because I haven't had legal training, I am not able to sort of answer that question as I would like to. But our legal experts had a look at that, and I can refer the question to our legal experts because they analyzed the legislation, and I can get back to you if that's okay with you.
Sure, thank you. So I guess this is discussed in our group yesterday. I guess the question is there a moral difference between secondary use for AI and secondary use for other things? Thank you.
That's a question we also discussed in our, I think in all our groups yesterday, right? Does it make a difference? And if there is a difference, why is there a difference? And I think we had this conversation as well. Is there something distinct about what those techniques that we're using for AI that pose perhaps other risks, or they have some sort of inherently morally selling difference? And I think that's a question that we're still working towards the answer, but I think it would be nice to pick it up again in the general discussion. Andrew, you had a question? Oh, no.
Yeah, thank you very much. Yeah, I was going to ask the same question for other countries. I'm from Nigeria, and we discussed it in our group yesterday. I'm not sure there is any regulation for data sharing in artificial intelligence that is different from others. We can check. We have done some background check, and then I will also want to, so these are general rules, these are general regulations, and it goes to show that we need to beef up the regulations, the rules, and the guidelines. And the Pechakucha that was presented yesterday also confirmed this. And also to say that you should look into, in the case of Nigeria, the National Health Research Ethics Committee Code is online. We have general guidelines as to data sharing. Thank you.
Thank you so much for that comment. So I just want to restate that we are conducting our research in phases, and this is the very first phase. And that table alone was very brief, and it was more focusing on personal information.
You mean exchange?
Yes.
Yeah. Okay, very good.
Information.
The protection of personal information, exactly. Okay. Andrew?
Thank you very much, Nezerith, for presenting on behalf of the group. I think we need to be clear about legislation of all sorts, in that laws are generally written in broad terms. So in South Africa, there is certainly no law specifying AI. So I hope that answers your question. None of the laws, like we have the Protection of Personal Information Act that deals with data and personal information, but not specifying AI to any extent. And I think in most sub-Saharan African countries, there's no AI-specific law. So these laws that do exist are more for data protection.
But I think that's not just here, right? I mean, we have, again, I'll take the example I know perhaps better. In Europe, we have the General Data Protection Regulation. It includes some relevant clauses there for automated processing of data, which would come as close as we can think of to AI. And right now in Europe, we do have this discussion and a proposal for the AI Act. And I think there are some lawyers here in the room that maybe can correct me, but I think that's the first piece of AI law that we're seeing anywhere. Am I right? Is that the first piece of law that we're seeing specifically addressing AI, correct? Yeah. So that, and it's not out yet, and it's not, we haven't even finally approved it, let alone enforcing it. But I think that's how, where we are now in the kind of evolution of our regulation in general. Okay, so I think we have to move on to our next. If there are more questions about the Nezerith paper, we have discussion after the second presentation. But